Hi, listeners.
Hello. Welcome to the Med Insights Unleashed podcast.
With your hosts,
Z.
and John. Hi, Zahra. How are you today?
Hi, John. I'm great. It's been a while since we've spoken because you were so busy with July the 4th parties for Independence Day.
Exactly. It's been a very welcomed relief of a couple of days holiday down here in the US with the 4th of July celebrations. And wow, what a fantastic Macy's firework display. It was unbelievable.
Yeah, Macy's always does a really great job. I know. I agree.
Yeah, we're very honored to have Dr. Ari Rosenberg here with us today to talk about head and neck cancer. Head and neck cancer, for our listeners, is the seventh largest cancer globally, with 890,000 patients newly diagnosed per year and 450,000 patients actually die per year, which is over 50%, which is not so good.
That's a high
But
number.
it is a high number. And something that there's a lot of discussion about, and we have got the expert here with us. And we're very honored to have Dr. Rosenberg from the Chicago Medical Center, who specializes in head and neck. So, Ari, would you like to tell our audience a little bit about yourself, the research that you're doing at Chicago Med, and tell us a little bit about the disease?
Yeah, absolutely. And great to see you both. And thanks for the invitation and good to connect. I also saw some pretty amazing fireworks displays myself. So that felt celebratory this year. Felt celebratory.
Excellent.
It did.
And you're based in Chicago, right? Yes, Chicago.
Yes. I'm based in Chicago, and over the lake, over Lake Michigan, they have some amazing firework displays there as well. Although I'm not sure it competes with Macy's, but what are you going to do?
We're all on fire about this podcast, though. That's the main thing.
Sounds good. No, thanks. No, so I'm a medical oncologist at University of Chicago, and I treat and focus my treatments on patients with head and neck cancer, which are cancers that develop anywhere above the clavicle, above sort of the collarbone, and even all the way up towards the sinuses. And this is a very challenging cancer to sometimes diagnose and treat, in large part because we're talking about very important real estate, a lot of things that we do with our head and neck: eating, swallowing, speaking, a lot of important functions in that space. So head and neck cancers can develop really in any of the spots, but some of the more common areas that you can have head and neck cancer include the oral cavity, like the tongue, or the oropharynx, areas like the tonsil, or even areas like the larynx, the voice box, and rarely even in areas like the nasal cavities or the sinuses, or even salivary glands. And so these are some of the different types of head and neck cancers that I treat.
Are there certain cavities that have a more higher, like, that are more common versus others?
Yeah, so the vast majority, about 95% of head and neck cancers are a type called squamous cell carcinoma.
Okay.
And the most common areas are areas like the oral cavity, such as the tongue, the oral pharynx, like the tonsil, base of tongue, hypopharynx or larynx, which is sort of the lower part of the voice box area. But any of those areas can develop a squamous cell carcinoma. And in terms of the more common types, certainly we see head and neck cancers related to carcinogen exposures, such as tobacco and alcohol. In fact, 50, 60 years ago, almost all of the squamous cell carcinomas of the head and neck were attributable to tobacco and alcohol, and were largely diagnosed in people that had been smoking and drinking for many, 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 many years, oftentimes before they had their ultimate diagnosis. But then, as smoking rates fell, and all of the smoking related cancers started to decrease in incidence, right? Lung cancer, esophageal cancer, many of the smoking related cancers were decreasing. The only one that was increasing was oropharynx, tonsil cancer, largely tonsil base of tongue cancer. And it was increasing in people who had never smoked,
Okay.
which was unusual and raised questions as to, well, what's going on here? Why is this traditional smoking related cancer not trending with all the other, smoking related cancers? And now we know that's because of HPV, human papillomavirus,
Right.
which is a sexually transmitted disease. And the vast majority of adults actually get exposed to HPV at some point in their lives, but most of the time we never know it because the immune system clears it, or it's an HPV subtype that doesn't cause cancer. But very rarely HPV can cause, among other types of cancer, like cervical cancer, can also cause head and neck cancer,
Right.
and can cause head and neck cancer in people that never smoked, and usually popping up in the oral pharynx, tonsil base of tongue area, sort of in the very back area of the throat. And now in 2024, this is actually a very common type of head and neck cancer that we see, oral pharynx cancer related to HPV. And so that's some of the causes of and types of head and neck cancer that we see.
Ari, there's been a lot of TV advertising about products like Gardasil 9, which is HPV vaccines. Is this playing a role in the treatment of head and neck cancer? Is this reducing it as we get into the younger age groups?
Yeah, it's a great, great question. And that's certainly the hope, and certainly what the future hopefully holds. We know that vaccination, before being exposed, before becoming sexually active, is the best way to prevent all HPV related cancers, and is recommended at those younger age groups. And I'll put a plug there. I'm a very strong proponent of
Yeah.
HPV preventative
Okay.
vaccination. Despite the fact that this is widely available, it hasn't yet made an impact on the incidence of HPV related cancers. And actually, the incidence is anticipated to continue to rise through, it's anticipated to predict around 2045.
Wow.
Still have some time of increased incidence, and that has to do with many factors related to the uptake of people vaccinating, and related to the amount of time it takes for an HPV related cancer to develop, which takes decades, right?
Mhm.
So there's a decades delay. And so these are some of the reasons why, it's going to continue to increase. But I completely agree with you, John, to your point that, the more people and the sooner we can get people, vaccinated per the recommendations, the better, because that's going to help improve that incidence curve
Right.
to hopefully down the road start to reduce the incidence, and ultimately reduce the likelihood of people to develop this type of cancer.
In summary, because again, this is an opportunity for me to learn as well. So the risk factors, as you just mentioned, would be tobacco, smoking, and then on the uptake would be HPV. I have two questions related to that. My first question is there a geographic disposition, or are there certain geographical regions that that have a higher incidence and commonality? And then second question to that is, what are some of the symptoms that, patients would kind of exhibit and need to be aware of?
Yeah, those are great questions. In terms of geographic distributions, HPV infection and HPV cancers, I should say, and HPV oral pharynx cancers are largely of particular note in Western countries, in the US, Western Europe, places like that. But in the US, today it's actually the most common type of oral pharynx cancer is HPV related. In terms of symptoms, it actually very much depends. So for HPV cancers, one very common way that people present is with a lymph node in the neck, so a lump in the neck that is oftentimes painless. And sometimes patients will say to me, "Doc, I was shaving one day and noticed this lump in the neck." And A lot of times patients have gone to their primary care doctor and maybe gotten a course of antibiotics with no improvement before they ultimately get some imaging and eventually a biopsy that makes the diagnosis of an HPV related cancer.
Okay.
So for HPV, that tends to be the more common thing. For things like tongue cancers, a lot of time, having an ulcer on the tongue that is getting worse or not getting better is this common symptom. Pain, oftentimes. For vocal cord cancers or for voice box cancers, a lot of times hoarseness
Okay.
is a very common symptom as well. The challenging thing is, of course, these are common symptoms for non-cancer
Right.
diagnoses
Yeah.
as well, which is important to say out loud for the average listener. But I think one of the more important things is how long have those symptoms been going on, right? If these are transient symptoms where they come and go, the likelihood that there's an underlying cancer is relatively low. Whereas having symptoms that persist for long periods of time that really aren't getting better with other treatment really should be checked out and evaluated for, so that these diagnoses aren't missed. Yeah.
It's interesting you bring that up because just recently I went to the dentist for my regular checkup, and they gave me an oral screening for cancer in the mouth, which was pretty
Hmm.
unusual. I've never had that done before, but they had the test out with the light and everything. That was very proactive approach to this disease, I thought.
Yeah, yeah, I think that's very, very important, and dentists should be keeping an eye out. We actually, at our center, we've done a number of courses, training courses for dentists to help improve on the ability to identify lesions that are suspicious or need to be biopsied, because we know that diagnosing, especially oral cavity cancer, at earlier stages is a very important predictor for ultimate outcome, right? We know that early stage cancers have a much better outcome than more advanced stage cancer. So early detection, early diagnosis is very, very important. And you're absolutely right. It's a pretty common thing that we see in the clinic of, hey, I was feeling pretty good, but my dentist saw something and they identified it and they said, hey, you should get that checked out. And they go to an ENT or to an oral surgeon and get a biopsy of the lesion, and it shows a cancer that needs to be treated. So, follow up with your dentist for the listeners, follow up with your dentist twice a year, and don't hesitate to let your dentist know if there's something that you see that you're concerned about or not sure about. Always ask and have it looked at. I think that's the right approach and proactive approach as well.
I need to remember that honestly because I don't I've never had that provided by my dentist, so it's definitely something I'm gonna ask for.
Yeah, apparently they're doing it more and more often.
Um,
It's actually quite interesting.
the other question I had was around because you mentioned early detection, right? So, what percentage would you say do patients present themselves at the kind of earlier stage? So, what percent, yeah, at the early stage versus the more advanced stage?
Yeah, yeah, it's a great question. The majority of patients with head and neck cancer are diagnosed when there's either local or local regional disease, meaning that the tumor is localized to the area where it started, or
Mhm.
sometimes has spread to some of the lymph nodes in the area. A lot of times for head and neck cancer, these are the neck lymph nodes that we're talking about. The good news about the fact that most head and neck cancers are diagnosed when there's local regional disease, meaning that the goal of treatment is cure. And for HPV associated head and neck cancers, for local regional disease, we managed to achieve cure actually in the vast majority of cases.
Okay.
So about 80 to even 90% of patients with HPV related oropharynx cancer are cured with a multimodality treatment approach, using a couple of different tools together in our back pocket. Whereas for non-HPV, right, the cancers that are more attributed to smoking or alcohol and don't have any HPV, the cure rates are not nearly as high, closer to only 50% or 60%, depending on where you look. So having HPV positive disease is very, very good. And again, these are numbers for local regionally advanced disease, right? So
Right.
cases where it's spread to lymph nodes in the area. Yet that being said, even in those cases, we managed to cure many, many of the patients. And so that's the goal. The challenge, of course, is right trying to cure more of those patients, and particularly those with HPV negative head and neck cancers. And of course, when these cancers come back, either in that area or in distant areas, in other parts of the body, that's a whole different ballgame. And there's really an unmet need to develop better and improved therapies over our current therapies to improve outcomes.
Go ahead, John. Okay. John knows I have 1,000 questions in my
No,
head. With regards to standard of care, right now, what would you say is a standard of care for your HPV positive patients? Is it chemo and radiation or?
Yeah, for HPV positive oropharynx cancer, most patients are treated with combinations of chemotherapy and radiation. Chemoradiation is a very effective, highly curative treatment for HPV associated oropharynx cancer. And in some cases where there's very small tonsil tumors or base of tongue tumors, there's also a role for minimally invasive surgery, particularly when those patients can sometimes even avoid radiation or avoid radiation with chemotherapy for very early stage HPV associated cancers. Those are some of the treatments, the standard of care treatments for HPV positive disease.
This is really, from the listener's perspective, a really multi-treatment modality disease where you've got multiple people involved. And is that a good center to go to ensure a great outcome, is where you've got an MDD team in place?
Yeah, John, you hit the nail on the head there. That's exactly right. You know, these cancers are quite complex and are best treated at centers that are high volume, that see a lot of head and neck cancers, and that integrate multidisciplinary teams. Usually that includes a head and neck surgeon, as well as a medical oncologist like myself, and usually a radiation oncologist. And having a team look at your case together as a group and discuss it as a group, make sure that the treatment approach is one that will not only optimize the likelihood of survival, but also optimize long-term function, speech and quality of life and swallowing function. And so having input from a couple different disciplines is very, very important. And I'll also broaden that and say that the multidisciplinary team is actually even broader than those three head and neck cancer experts, because during the treatment and because of the side effects of both the cancer and the treatment, there can be major impacts on swallowing and on speech and on function. So usually as part of the team, there are dietitians and nutritionists that are integral parts of the team, as well as speech pathologists that focus on optimizing speech and swallowing function, as well as dentists and oral surgeons, particularly when we're thinking about radiation-based treatments in this part of the body, as well as many others, highly specialized nurse navigators that have expertise in the disease,
Wow.
optimizing folks that have expertise in pain control and pain management, physical therapy and occupational therapy, and many, many, many others, right? Even within surgery, right? There's surgeons that focus on the skull base and those that focus on robotic surgery for tonsil cancer, and those that, neurosurgeons, right? I mean, so it ends up being a very broad team. I can tell you that in our tumor board, when we're discussing these patients, we have typically on an average tumor board, well over 20 specialists that are on these calls,
Wow.
including radiologists and pathologists. And it ends up being a very big team of people that are discussing the case and trying to identify from all the different perspectives, what is the best way to treat? How do we personalize the treatment approach for this particular patient, for this particular cancer, taking into account the overall picture, again, to optimize the likelihood of survival or hopefully cure in the majority of cases, while also minimizing the side effects of treatment and optimizing long-term function.
It's John, that was a really great point that you brought up because we've heard it consistent in all of our previous episodes, right? So, John and I've recorded some sessions around liver cancer, And typically they do have the MDT approach. But Ari, what you were just saying again, even so, regardless, the MDT approach is something that's so critical and patients need to be made aware. Then there's kind of the other side question I was going to ask was, if a patient lives in a more community kind of rural setting, do they have access to that, or can they only access the kind of MDT from a academic center?
That's a great question. And data suggests that that's actually the most important thing for head and neck cancer is receiving treatment at a high volume head and neck cancer, right? So a center that takes care of a lot of head and neck cancer, because within that goes into teams that are multidisciplinary, that have the resources and the supportive care that's needed to get patients through, optimized treatment. So there is a good amount of data that outcomes for patients that get treated at a high volume center are better. That being said, a lot of times we'll collaborate frequently with colleagues to help try to make sure that patients can receive the best possible treatment at the best place that's right for them, because everyone's different and everyone's context in life has its own circumstances, and a lot of times that's something else that we're able to do. So it's very, very much personalized as to what's right for what patient, and that includes who that treatment team is. And it's a very collaborative area, right? We all want what's best for the patient. We all want the patient to receive the best care that's best for them and their circumstances. And we should do whatever we can to support that outcome.
Ari, just to close this session off, and I know that you're coming back to do another session on the future and treatment of head and neck cancer with us, what would you like to say to your patients are the top 3 to 4 key points about head and neck cancer from your perspective today to the listeners on this call about their potential for treatment of head and neck cancer?
Yeah, that's a great question, John. I think number one, and we touched on it a little bit, but get evaluated by a multidisciplinary team that has a lot of experience with head and neck cancer. Get a recommendation and then go from there and figure out what the best treatment approach is for your particular case. I think number two is head and neck cancer treatment requires a lot of support, and thinking about that support up front is helpful. So who are the individuals in your life, in your world, family, friends, who you can lean on? Don't be afraid to lean on them, and bring them with you to the appointment and have them be an additional set of ears. And friends and family, they want to do that. They want to support you, and that's very, very important. And I think the third is, if you notice something, whether you're a patient or not, that's new or unusual, it never hurts to ask your medical team and bring it to their attention. And that's helpful, right? Being proactive, having ownership and initiative helps your medical team take the best care of you that they can. And having that be a team-based approach, I think, is very important, right? The treatment team and the patient working side by side and collaboratively is going to optimize the outcome. So I think those are the 3 take-home points that I'd say, and hopefully we'll continue to improve our treatments for this disease. We'll talk about that soon.
Yes.
Ari, we just want to thank you on behalf of Med Insights Unleash and our listeners for this great introduction into head and neck cancer today. And thank you very, very much. Your insights have been fabulous. And on behalf of Med Insights, thank you. And we'll listen to your next episode coming on just shortly on treatment of the advanced stage head and neck cancer patient.
Thank you, Ari.
Wonderful.
That was fantastic. Thank you.
Wonderful. Thank you. Thank you.
Med Insights Unleashed disclaimers. This podcast is for general information purposes only and should not be considered healthcare advice in any way. The podcast is not intended to replace professional medical advice. The use of the information and material linked to the podcast is at the user's own risk. MedInsights Unleashed is not responsible for any losses, damages, or liabilities that may arise from the use of the podcast. Importantly, please consult your healthcare provider for individualized guidance and treatment. Thank you, and we look forward to you being with us on the next MedInsights Unleashed podcast.